morning, ma'am. I'm Judith Ramos, and I will be your student assist for today. And here is my patient, Carvalho, as the mommy. Thank you. Okay, so first off, in this checklist, I will be monitoring maternal vital signs and fetal heart tone every hour while in labor. Sorry, mommy. Mommy, I will be checking your BP po. Mm. Very nagmakatingnan eh. Okay, so assuming that her BP is 120/80, assuming that, and I'll also be assessing I'll also be doing the Leopold maneuver sa aking inay. So, ayun. So, expose ka sa taklit. Yan. So, kunwari, ayan. Leopold's maneuver. Yan. Okay, so her vital signs are like 120/80. RR is RR is 40, and etc. And this is to evaluate maternal and fetal condition and tolerance of labor. Thank you po, mommy. And next, I will be placing our parturient in a lithotomy position. So, mommy, please face his left side and the other one on the side. And this position was the standard birthing position for better access to both mother and the baby. Now, Daddy, I will be assisting the husband to put on cap, mask, and gown if allowed. So, ito po ang ating Daddy. So, sir, here is the... Ano? Sige. Wait, doon ba? Doon dito. Ayan. Ayan. So, assuming na... Assuming na, ayan nga, may gown, may mask, and may gloves. Okay. Ayan. So I have assisted the husband of the mommy for this allows parents to interact more freely with the infant and prevents any contamination. Yan. Okay. Next, I will be coaching on proper breathing and bearing techniques. Mommy, Ayan. So, breathe in and out. From the nose to the mouth. Ganun. Kumari lang. Yun. 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 So, the breathing techniques provide distraction from pain. Oh, breathe, mommy, breathe. And give her a sense of control. And this gives a woman a different focus during contractions and interfering with pain sensory transmission. And I will note for the baby's delivery. Ayun na, nag-deliver ng anak. Okay, note. March 25, 1:30 a.m. Yun, nag-deliver na. So the time of birth completes delivery of the infant, and timely documentation helps to ensure patient safety. Okay. Now, I will be injecting 10 new oxytocin IM on mother's deltoid or thigh. So, kunwari lang sa deltoid or thigh, the thigh of the mommy. Pwede ka na po. Pwede na ba?
Skin shit.
Oh my God, girl. Shut up. Ano sasabihin ko?
Inject.
And next is I will be injecting 10U oxytocin IM on mother's deltoid or thigh. Yan. Ayun ka, hindi pwede. So, ayun. After, so this is my oxytocin. 10. Ew. On the second. After excluding a second baby. So, kunwari, ayan. Na-inject ko na si mommy. Ayan. Ay. So, wipe first, and then do aspirate, and then discard, and then and this stimulates the uterus to contract thereby helping to prevent hemorrhage. Next, I will be regulating the IV with oxytocin in cooperation with the desired rate. So, kita yan. So, pretend, assuming that I'm regulating at 32 drops per minute. Okay, so yun, 32 drops per minute. And I will be monitoring mother's vital signs again, especially BP after placenta delivery. Mommy, I will monitor your vital signs again, and I will take your BP po. Okay, so assuming that I have already taken the vital signs and the mother's BP, it is 120/80, and this helps provides assessment information about hypovolemia, excessive blood loss caused BP with increased pulse rate and decreased respiratory rate as compensatory mechanisms. Next, I will also be changing the mother's gown if wet or soaked with blood. So, assuming that it is wet, so mommy, I will be assisting you po in changing your gown. So, assuming that this is the new gown of the mommy. Ay, joke ko lang na. So, this provides comfort and prevents infection. and I will be transporting the mother to the recovery area. Nagtatransport po ako ng mommy to the recovery area or to the ward safely and monitoring the client's status in the recovery area for the first 4 hours. Postpartum is the critical period to observe it for any signs of postpartum hemorrhages or any postpartum complications. So wala naman po any complications and I will always be monitoring again the vital signs of the mother, the BP, etc. during the first 2 hours, every 30 minutes of for 1 hour and every 4 hours until stable. So, nagmamonitor ako. Check ko na. So, monitoring vital signs are important indications of mother's condition after birth, and the rising pulse is an early sign of excessive blood loss because the heart pumps faster to compensate for the reduced blood volume and the blood pressure falls as the blood volume diminishes and late signs of hypovolemia. And I will be assessing for any firmness, height, and positioning of the uterine fundus. Can I please? Okay. So the fundus height is still here of the synthesis pubis since it is just after delivery. Ayun. And the positioning and with each vital assessment for assessing, thank you po mami, for assessment provides information about the uterine tone, height, and position, And the most common reason of excessive postpartum bleeding is that the uterus does not firmly contract and compress or open vessels at the placenta site. And if the fundus is firm, no massage is needed. So, firm na po ang ating, the fundus of mommy. And next, I will be documenting, recording all assessment done and vital signs the patient's chart, and notify primary caregiver for any deviation from normal findings. So I have recorded that the mommy's BP is 130/80, and the fundic height is about the syphilis pubis, and there are no complications in bleeding or anything, and that the fundus is firm, and etc. And the date and time of the newborn, delivered, etc. For proper documentation provides information of the status of the client after delivery, and notifying the primary caregiver for any abnormal findings will require other interventions if other measures are ineffective, like stopping hemorrhages. So thank you po, mommy, and if you need anything, please call me and I will now be performing hand hygiene and will be notifying the physician. Thank you po.